Many of you know that TB is a disease which affects the lungs, but how many of you know that it can affect the bones as well? Among the bones, spine is the most common place for TB to occur, and it is commonly called Pott spine. I would like to share an interesting case of a young 25-year-old female who has been having abdominal and back pains for quite some time. She had met a lot of gastroenterologists, was evaluated for abdominal pain, but suddenly one day she landed up with weakness in the legs or paralysis. The evaluation then turned to the spine, and on evaluation we found that she had TB in her spine, where a lot of pus has collected around her spine, causing the nerves to completely get compressed and landed with weakness and loss of sense in the legs. So this is called a Pott's paraplegia. This is a condition which can commonly happen in endemic places such as India, where we are very often exposed to TB around us, but many of us do not have the symptoms because of our immunity levels. But this infection, which starts in the lungs or in the urine, can gradually spread into the bones and land up in places such as the spine, and from then on the TB starts building up there, causing the bone to be damaged. Now in her case, one of the bone is completely destroyed and two other bones are also getting damaged because of this TB. So it will need a urgent surgical decompression. We have explained her the same, and we took her up to surgery on the same day because it is an emergency, and we had to remove one complete spine bone called vertebra and put in a cage to bridge that gap, and also put in screws to fix it and also release the pressure on the nerves. TB in a sense is rewarding surgery for some patients who present similarly, because when you completely lose the sense in the legs and completely lose strength, it is unlikely that you may recover. Cases like TB, there is a chance if you intervene early, you can get back your power. So she and I are fortunate, and I'm very happy that now she is walking on her feet well and fine, and she has to be also medically managed with good anti-TB therapy which she had taken. I would like to stress the fact that TB spine is a common condition and has to be kept in mind, particularly if you have fever associated with back pains, weight loss associated with back pains, or loss of appetite. You don't feel the urge to eat even if you are not eating well is a common symptom, and if you have abdominal pains associated with back pains.